Good morning. Thank you so much for joining us for this episode of SBB Live Doc Talks. We have Dr. Stephen Schafer with us here this morning from Coastal Orthopedics. How are you this morning?
Doing well.
Wonderful. Thank you so much for joining us. So I wanted to ask you to tell me a little bit about yourself and your background, what led you to this industry. Talk to me a little bit about the history of Coastal Orthopedics.
Steve Schafer I come from Michigan, went to the University of Michigan for undergrad and medical school. Met my wife in Missouri when we were residents, who's now also one of our physicians. Then followed her down to Florida. And then we started here, believe it or not, yesterday was 20 years. So I started 20 years ago yesterday. History of Coastal Orthopedics started as a group of several guys back 40 plus years ago, became Bradenton Orthopedics. Then sometime maybe 10, 15 years ago, maybe we switched the name to Coastal. And we've grown from when I got here, I was the 5th orthopedic doctor, and now we've grown to kind of over 15 doctors.
Wow.
A lot of growth, growing with the community.
Yes. Well, first and foremost, happy anniversary.
Yeah.
That's a big accomplishment. Something you should be very, very proud of. So today's topic is going to be just an explanation of sports injuries, and I'll have a few icebreaker questions for you, but talk to me a little bit about the explanation of sports medicine in general.
I look at sports medicine as the overall treatment and prevention of injuries related to sports and exercise. I mean, there's a whole gamut. I mean, sports medicine may, on one end are the athletic trainers, the physical therapists, now you got exercise physiologists. You may have, sports psychologists, the whole gamut of people that manage sports problems. And then on the physician side, you say there's kind of two different physicians that take care of sports injuries. One are the primary care doctors, who still see a lot of the same injuries we see, but they'll also see things like maybe exercise-induced asthma. They'll see some other problems related to sports that aren't injury. Then as orthopedists, we see probably more injuries, people with knee injuries, shoulder injuries, and a whole gamut of injuries related to sports. And then the ones that need surgery, we also perform surgery on patients who have sports-related injuries.
So talk to me about the importance of exercising, and as you age, even if you're not into summer sports, what are some of the exercises that we can be doing to keep ourselves young and active and healthy?
I mean, there's a whole lot of exercises that people can do. Even simply walking is better than people think. Aerobics, hiking, jogging, the Zumba classes, Tai Chi. There are a lot of different things that you can do just to stay active. Sometimes something as simple as here I'm sitting in this chair, but I spend most of my days in the office. I try to stand as much as possible. If I have the choice between the elevator or the stairs, I tend to take the stairs. Sometimes exercise isn't even just an activity as much as just a lifestyle. How do you stay as active as you can? Mm-hmm. And answer your question is the why is, a lot of different reasons. Cardiologists have different reasons why exercise are good as opposed to orthopedists. For the overall health, it helps manage weight, helps manage diabetes. There's psychological advantages to people who exercise. Orthopedically, we probably see it's good for bone health. People who have better bone health if they're active. People who are sedentary usually get more osteoporosis. And then people who we all lose muscle mass after the age of 30. So just as we lose our muscle mass, people as we age are more risk for falls. To us, falls are more fractures, more major problems. So if we can maintain strength and maintain balance, all exercise is good to maintain all that. So I guess I'm getting as a difference. Cardiology have their benefits.
Yeah.
Independent orthopedics, maybe you can argue theirs are more important than ours. Overall, there's a lot of reasons for
maybe not, because falls result in some of the highest death rates, and falls can be very serious. So preventing falls is is a really big deal. Now,
Huge.
as we go into the summer and we have some of these summer sports, people like their pickleball and golfing, and you mentioned Zumba. I see that as a catastrophic event happening for me. I'm very, very uncoordinated. So what are some of the sports injuries that you see the most of in these summer sports, or just in general?
In the summer, you're right. It does change a little bit. Obviously, in the fall, we've got football, we got soccer, we have all these the young athletes and having those injuries. But during the summer, most of the schools are out of their programs. Even a lot of the summer soccer programs are sitting back. They're still playing baseball, but most baseball players tend to get more overuse injuries than they are specific injuries. So what I see an awful lot more is like the tennis players, pickleball. You mentioned pickleballs, common injuries related to those sports, and probably more the typical weekend warriors, people out during the summer months because of, the kids are off school and they're out doing more, and you see those kind of injuries more than you do during the school year.
Yeah, you say weekend warriors. I've been trying to help remodel my house on odds and ends, so I'm at danger for like a nail gun or something.
But yet, as you point that out, is sometimes we look at sports injuries. I mean, how should I put it? A lot of the injuries you see in sports medicine are the same injuries you might get somebody at work. I mean,
Yeah.
or you are doing work around the yard, and whether you slip awkwardly and injure your ankle on a soccer field or doing yard work, the injury's the same.
Or walking down the stairs,
Yeah.
Well, what would you say as we age? We're looking for exercises that not only are safe, but that can also improve our balance and improve our bone structure. What are some of the things that we could be doing to keep ourselves active that will help us prevent these injuries that we're talking about today?
Sometimes it's a loaded question because, some of the stuff people do are overuse. A lot of the problems I see of patients who are very active, but they're overusing. And so some of the things we see are overuse related. So some of the simple things are the things you think of that to prevent injury. Walking as much as I put up fuss. I'm not a big walker myself, but I recognize that it's because I always feel like it doesn't do much for me, but I know that the science is that it does. So I think even just routine walking or taking hikes or again, I mentioned Tai Chi, and there's other things that even something as simple as you see patients who dance regularly. I mean, there are some exercises that, because I think the reality for me is if patients don't enjoy it, they don't do it. I mean, so if you're not a runner, to go out and try to run, most people don't stick with it if they don't enjoy it. The runners who enjoy it, they'll stick with it because they enjoy it. So you got to find something that you enjoy, that you're more likely to stick with. And that's a whole, again, white walking, hiking, aerobics, all the different things you can think of that are good for them.
Well, Dr. Schafer, I'll leave this with you. If you see me running, it's because someone is chasing me.
Yeah.
Walking, totally my speed. Elliptical, love it. Running, it's not for me. So you're absolutely right.
I'm a big believer in biking. Biking is non-impact and it's enjoyable. So especially the problem with biking is just, depending on the time of the day, some biking on some of the roads is not, it's not an injury, but it's a concern for the cars. So a lot of the local bike trails are very good though. and they're safe. So
or stationary bikes for those of you that to exercise at the gym or in your home gym.
Yeah. Swimming too. Swimming is great exercise if they have access.
Yeah, and I think Tai Chi probably takes the cake because that is so fantastic for our aging population. It helps with balance, exercise. Just one of the best, programs out there for sure.
And also the Pilates, yoga, and all those are also very good.
Very good. Very good. All right. Well, thank you so much for coming on the show today. It was a pleasure getting to know you. And once again, happy 20th anniversary there with your practice at Coastal Orthopetics. We appreciate your partnership so much. And I look forward to doing another interview